Welcome. Let's talk about a patient on CPAP who either refuses to use CPAP any longer or they've refused to use CPAP from the start. Now, it's important to figure out whether this is assuming that the patient's already had any problems related to CPAP addressed. So if they refuse CPAP, which some insurance will require before they move on to the next step, or they fail CPAP, as in the patient failed to adequately be compliant due to issues related to CPAP, then the next possible step is to consider using a mandibular advancement device, or MAD. And what this is actually an oral appliance therapy for sleep-related breathing disorders and so on. Now, the first step as well is to figure out some of the things to consider. One is, like I mentioned again, insurance. If the insurance will pay for it. Some insurances don't, so it's best to check with the patient's insurance carrier. Number two is to consider the mandibular advancement devices as something that's not proven till after they've been fitted for it. So once they have them fitted by the dentist, only then will they have a repeat sleep study done to assess the effectiveness. So the effectiveness as well is not truly known until the mandibular advancement device is set up for the patient. The next thing is to consider in patients who are obese and patients with severe OSA. In those patients, the effectiveness of the mandibular advancement device may not be as good. The next thing to consider is cost. Now, cost as well may be higher upfront, especially in a lot of patients, depending on what insurance is. So that may be something to consider in deciding a next step after using CPAP. Some contraindications include TMJ disease, patients with poor dentition, and for example, if they have gum disease and so on. So speak to the sleep certified dentist to figure that out. Now, what is a mandibular advancement device? A mandibular advancement device is what it really is it's actually an oral appliance therapy that's made up of two components fitted within the upper jaw and the lower jaw that will help with the treatment of primary snoring and sleep-related breathing disorders. So again, what it basically is, it's made and fitted for that patient specifically. Now, understand your upper jaw and your lower jaw or your oral anatomy is specific to each individual the same way your thumbprint is specific to you as well. Now, what it's not is to consider it is not a mass market device. It is not something that you purchase over the counter. It is not something that's bent or shaped or manipulated to fit the patient's jaw. All these devices may be something you can get quickly and cheaply. They may work for a while, but they may alleviate some of the symptoms temporarily, but doesn't really effectively treat the underlying problem. So, what it is made up of, it's made up of an upper and a lower jaw, and it has these instruments over here that allow the lower jaw to be protruded by at least or by more than 5 millimeters to allow for effective treatment to treat the obstructive breathing events. The other thing is it will be advanced by 0.5 millimeters to 1 millimeter every few weeks or months by the sleep certified dentist. So that's why it's important to find a dentist who's thoroughly experienced in using these oral appliance therapies, not only for snoring but also to treat sleep related breathing disorders such as obstructive sleep apnea. So you can find this dentist on the American Academy of Dental Sleep Medicine website, and I suggest that's where you should start first. Now, once that's protruded and everything has concluded from the side of from the dentist, now it's important that the patient then undergo adequate testing with a repeat home sleep study or an in-lab study. Now, it's important to evaluate or compare apples to apples. So if the patient had a home sleep study to diagnose obstructive sleep apnea, then repeat that with the device in place using home sleep study. And the patient had an in-lab study, then use that to evaluate the effectiveness. Now, some patients may feel like the symptoms have improved and refuse or are hesitant to repeat a home sleep study, or an in-lab study, but it's important that not only the subjective symptoms are treated, but also objective documentation of improved breathing events. Now, usually you want to minimize it by getting the AHI less than 5. However, in some patients who have had at least a 50% reduction in breathing events, that may help them as well experience some of the benefits of treatment for OSA. Now, what happens if a patient is responsive initially, but after 3 years they have an issue with breathing events returning? Now, most devices are expected to last at least 3 years. So after 3 years, consider whether its effectiveness of the MAD or the mandibular advancement device is truly as it was when it first fitted. So a repeat home sleep study or an in-lab study may be required, especially if patients have recurrences of symptoms. Now, if it's less than 3 years, while you should still consider mandibular advancement device effectiveness, consider as well concurrent depression, weight gain is an issue as well, and medication effect. So these are some of the confounding problems as well related to the recurrence of symptoms. Now, some practice tips. I find it's better to not be a purist in this situation. So if you have someone who's not tolerant to CPAP, partial treatment is better than no treatment. So if you can work with them and try to alleviate some of the symptoms and reduce the AHI, using the mandibular advancement device may be a great option. In some patients as well, you may need a combo therapy, especially if patients have frequent travel, a travel agenda, for example, if they're business travelers and so on. Some may opt to use the mandibular advancement devices. Now, if some people can afford it, they may want to use a combination of both CPAP for home and mandibular advancement devices for travel. Thank you.